Hello, I'm Dr. Sambir Aire. I'm a board certified aesthetic and plastic surgeon. I do practice in Mumbai, Goa, and Ethiopia, and I'm the founder and director of Evolve Cosmetic Clinic. During my 15 years of practice, the most common procedure which I have performed is breast implant silicone surgery, and the most common question which is asked about breast implant surgery is whether do they rupture, are they safe, do they cause cancer, or do they interfere in normal life. So in today's video we are going to discuss, and I'll give you details regarding all the details about breast implant silicone surgery. Let's start with today's video, and the first thing what we'll discuss is what is breast implant. Breast implants are silicone implants, and they come up with a shell which is made of silicone, and inside they have a cohesive silicone gel. So practically, if you ask me about implants, they do not rupture. The chances of breast implant rupturing is very small, or consider it to be nil. So the risk of implant rupture is nil. So these implants are made up of silicone, and we usually put it in your breast so that you get the desired augmentation. There are different kinds of implants which are available. This what you are seeing right now is a smooth implant. This is the most advanced 5th generation silicone implants what we are using nowadays. This comes with a warranty of 10 to 15 years, and if you have any issues with the implant, then those implants are replaced free of cost if you take the warranty. What is the other type is what you can see here. This is a kind of a nano textured implant. So the difference between the two is this is a smooth one and this is a nano textured one. So there are different kinds of implants. One you can categorize into a saline implant or a silicone implant. In silicone implants we have round implants or anatomical implants. In round implants we have smooth implants, micro textured, nano textured, or textured implants. We have stopped using textured implants for breast implant surgery. These days the most common implants what I use are the smooth round silicone implants. If you are looking for anatomical implants, then in anatomical implants you only get a micro or a nano textured. It's very rare to get smooth implants in an anatomical implant. So this is regarding what are the different types of implants which are available. What does the implant actually do, and who are the candidates for breast implant surgery? So actually implant we put it just below your breast. We can put it below your muscle also. We can put it below the fascia. So there are three to four different planes in which we can put the implant. The ultimate goal of putting an implant is to give you augmentation so that we can increase your size. Whatever size you desire, we can give it to you. Second thing is the shape. What you achieve with implants is a good fuller look, plus to that a very good shape. What you get a good outer margin, plus to that you get an excellent cleavage, upper round margin, so your breast looks very beautiful. Who can do breast implants? So breast implants can be done by anybody who is more than 18 years. We actually wait from 18 to 20 years for we give a chance for your breast to develop. Once we are sure that your breast have developed and it's not going to increase normally or physiologically anymore, we can suggest you to go ahead with the implant. So anybody who wants to increase the size, anybody who wants a correction, sometimes during cancer, because of cancer of breast, we need to remove your breast. At that time we can use implant to augment and give you a breast. Fourth thing, if you are having a symmetrical chest, one breast is small, one breast is big, then to correct this also we can use implants, plus to that we can add another procedure with the implant. So these are the basic indications for which usually we suggest you to go ahead with breast implant surgery. what are the types of implant and how to choose the right size for you. So if you are considering a breast implant, you should know what are the type of implants. As I have already told you, basically we categorize into saline, silicone, round, anatomical, and depending upon the texture. There is one more thing you need to know is which are the companies which are providing implants in India. So usually Motiva, Sebin, GC Aesthetics, Polymed, there are 4 or 5 companies which are providing implants in India. What we are using these days is the most commonly is Motiva implants, because it comes with a warranty of 10 to 15 years and these are considered to be the best in today's time. So if you are considering a breast implant, the most common thing what comes to your mind is what size is right for me, how should I choose this size. So definitely when you come for consultation, we show you some before after photos. We try to explain it to you what is the cup size, what is the bra size, and depending upon that, if we use a particular implant, what kind of augmentation you can expect. For example, you can go from cup size B to C, B to D, C to D, C to E plus. So depending upon the volume and the projection of the implant, your cup size is going to increase. When you come for consultation, we also give you the actual sizes to wear, so that once you wear those sizes, you get and you look in a mirror, you can take photos, you get an idea okay, with this implant what kind of augmentation you can expect. So you get an idea okay, how much of fullness, how much of projection you are going to get, for example with a 300, 350, 400 cc implant. So it helps in making your decision little bit easy. So the next thing which it comes is, before proceeding ahead, what are the pre-op instructions. So pre-op instructions are very simple. We ask you to stop smoking for at least 15 days. If you are taking alcohol, we do advise you to restrict your alcohol and stop it at least 7 days before the procedure. If you are planning to travel to India, we do suggest you to get certain things ready before traveling. Apart from this, there are hardly any precautions which you are supposed to take if you are looking for a breast implant surgery. So once you come to us, either if you are landing out of like a country to in Mumbai, or if you are coming and visiting us in Mumbai, we get you investigated. We ask you to do certain tests. Once we see your reports, we do post you for surgery. The surgical process. The surgical process, there are different options available in the surgical process, like the type of incision. Usually there are 3-4 types of incision. Like we can take an inframammary incision where we take a cut under the breast. We can go through a transaxillary approach in which we take a cut in your axilla so that there is no scar on your chest. We can take a periareolar incision in which we take a cut around your areola, go through your breast, put the implants and come back. And the fourth is we can also go for a transumbilical, in which we take an incision in your umbilicus, we create a plane till your breast, we put the implant and then come out. So these are the 4 types of approaches in which we can do the implants. The most common approach is the inframammary approach, in which we take a cut below your breast, we lift your breast, we put the implants, we come out. Most of the times in this process, I actually don't touch your breast. So I am not going to interfere, I am not going to cut, I am not going to damage your breast. So your breast and me, we work in 2 different planes. I try to put the implants below the breast so that the implant is actually not in contact with your breast. After the incision, the next come is the placement of the implant. So either you can place it in the gland breast tissue itself, which I usually don't do these days. The most common plane which I put implants is the subfacial, in which I elevate your pectoral fascia, I put the implant and come out. The third plane is a submuscular, in which we put the implant below your muscle. Usually if you are going to periareolar approach, you can use a dual plane, in which half of the implant is below your muscle and half of the implant is below your fascia. So these are the 3-4 types in which you can put the implant. The most common placement these days for me is subfacial, because the kind of projection you get, the kind of result shape you get with the subfacial implant is excellent as compared to the other approaches. Now comes, after the surgery comes the most important part. What are the post procedure instructions to be followed? So definitely it's a daycare surgery. We give you a good amount of dressings that you are supposed to carry with you. You can travel the very same day, or you can travel the next day. What you need to do is, for 3 weeks you are not supposed to lift any heavy weight, you are not supposed to do any exercises, you are not supposed to exert yourself, you are not supposed to do swimming. Smoking and alcohol you are supposed to at least avoid for 10 to 15 days after your procedures. We'll tell you what kind of dressings you will need. Usually we try to put a waterproof dressing for you, so that post procedure you can take a shower daily. So regarding your medicines and rest of the things, we give you instructions. You are supposed to follow the instructions what we give to you. So finally, there are three things what you need to consider is, what are there any complications, what are the chances of you getting a cancer, and finally the cost. So the first thing is complications. See, any surgery has its risk. Once we get you investigated, we know ki if you are having any extra added risk. If you are not having any risk, you can go ahead with the procedure. Second thing, regarding the complications, we have done so many procedures till today, we have hardly faced any complications. So the way in which we do, we don't expect you to land up with any complications. The next thing what you always ask is whether implants can cause cancer. We have found out in 90s, in early 2000s, certain kinds of implants which were used at that time were associated with certain cancer thing, but these have not been proved. So we have stopped using those textured and those kind of implants. After that, there is no case study or no research material available which shows that the fifth generation implants what we are using can cause cancer. So definitely you don't have to think in those terms. Plus to that, the basic advantage of you doing procedure with me is, I actually don't put the implants in your breast. It's below your breast. There is no direct contact of your breast, so there is no chances of you having getting a cancer because of the implants. Plus to that, your breastfeeding, physical intimacy, nothing is interfered. So whatever you used to do 3 weeks before, like before the procedure, you can do it 3 weeks after the procedure. So after a month, you are completely back to the normal what you were before the procedure. And finally, that brings us to the last thing, which is the cost of breast implant surgery. So breast implant surgery cost, usually if you are doing it with Evolve, we give you a range from 1 lakh to 3 lakhs depending upon what kind of package you take, what kind of facilities you prefer, and which implant you choose. So if you have liked this video, then definitely subscribe to our channel, try to share this video, and if you are having any questions, queries regarding breast implant surgery, you can put it in the comment box. We'll be more than happy to help you out. Thank you.